All right.
We got 18 people. Yeah, the beaches have been taken over by the homeless, especially in Venice Beach. I've gone out there to actually work with their street outreach so I could learn a little bit more on how they're handling things and bring it back to here in Denver, since they have much more experience than we do. And I've learned some pretty amazing things that they do out there.
Yeah.
All right, good morning, everyone. While we are finishing up roll call, I'm going to welcome you all to Jacob's and I's first meeting, attempting to co-chair and lead you all over the next 12 months. So good morning and welcome to Bhpac. I hope you're all doing well this morning and you're enjoying your fall day. Are we almost done with roll call, Donna?
Yep, I think I've got everybody. I got all 19 of us.
Okay. So introductions, I'm Bob Dorsheimer. I am the one of the co-chairs.
Okay, Jacob.
My name's Jacob Marion. I'm also the other co-chair.
All right, Crystal.
Good morning, Crystal Olives with Sobriety House Treatment Committee.
Okay. And Daryl. I think I got Daryl away from his computer. Welcome back to Daryl. How about Natalie?
Good morning, Natalie Brown, Program Manager for Community Recovery Services at Summit Stone Health Partners. I'm on the Recovery Committee and the Membership Committee. Nice to see you all.
Great. And James?
Morning, everybody. James Gannon, Human and Active and Sustained Recovery Director of Programs and Supervisor at Advocates for Recovery Colorado, and I sit on the Recovery Committee.
Thank you. Let's go with Margie.
Hi, everyone. It's Margie Grimsley with the Colorado Federation of Families for Children's Mental Health, and I'm on membership and then prevention when we were meeting.
Wonderful. Laura. Laura, are you able to unmute? Okay, I got a head shake him now. All right, let's come back to her. How about Keith?
My name is Keith Hayes. I'm the Director of Recovery at 5280 High School, as well as a man with lived experience. I sit on the Membership Committee.
Thank you. And I see Daryl came back. How about Daryl?
Good morning. My name is Daryl Brown. I'm currently on the Recovery Committee. And also I am the intake coordinator over at Sobriety House of Denver. And I am a member in long-term recovery. Thank you.
Thank you. Let's go with Lorraine.
Hi, everybody. I'm Lorraine Hall, person in long-term recovery, and also I'm on the board for Life Rings Secular Recovery. And the recovery committee was my thing last time.
Good. Thank you. How about Nancy?
Good morning. I'm Nancy King, Development Director for Southeast Health Group, a person with lived experience and a family member, and I'm on the treatment committee.
And let's go with Brian.
Morning, Council. My name is Brian Laney. I sit on the recovery and the membership committees.
Wonderful. And Lloyd?
Good morning. My name is Lloyd Moore. I'm a person in long-term recovery. I am your membership co-chair. I'm on the recovery committee, and I am also a part of Last House on the Block. Bob and Jacob, and well, everyone, I am not going to be able to stay on, but I might be able to stay on and listen in. I've got an emergency that came up. So if you got anything about membership, throw me to the front, please.
I'm sorry to hear that, Lloyd. Melissa.
Hi, Melissa Mouton, person in long-term recovery. Good to see you guys.
Good to see you. Marcella.
Good morning, everybody. I'm definitely in a mood of celebration. I just had a total knee replacement, left knee, and I am amazed because I drove in today. It's only been a week and I'm just doing super well, no opiates, no nothing. And so it just shows, right, that old ladies still can. I sit on the, again, my name is Marcella Pies with IDEA. I sit on the treatment committee, and I think I'm also on the Bob Dorschmeyer committee. I'm not sure what that is, but I think I do. It's yet to be formally named, but thank you. I'm glad that I'm here today.
That's awesome, Marcella.
Yeah, just a week.
Congratulations.
Yeah, thanks.
Ty.
Good morning, everyone. My name is Ty Smith, and I am your representative to the MHDCJS Task Force, as well as Chair of Statewide Independent Living Council. And I'm a peer, a person with lived experience, and that's about it. Thank you.
Wonderful. Thank you, Ty. And let's go with Ryan.
Ryan Templeton, I represent the Office of Behavioral Health on Bhpac. I also serve as liaison between Bhpac and OBH.
Awesome. And Aaliyah.
Hi, everybody. Aaliyah Andrews. I am your recovery TA at the Office of Behavioral Health.
Okay. And Jacob.
Morning, everybody. Jacob Fry, Director of Operations with Sobriety House.
Thank you. Angie.
Morning, all. My name is Angie Bertrand. I'm the Executive Director of Pier 180 Recovery Community Organization in Grand Junction, Colorado. I'm a woman in long-term sustained recovery and interested in the Recovery Committee.
Wonderful. And Bonnie.
Yes, good morning. This is Bonnie Holiday with Office of Behavioral Health, and I'm your prevention TA.
Great. And I'm Donda Gorton. I'm with the Office of Behavioral Health, and I get to take all your minutes and keep you all on track. So going forward with that, I'm going to go ahead and turn this back over to Bob and Jacob. Is there anybody I missed before I do that? I think I got everybody. Okay.
Good morning. Buenos dias. So I'd like to walk through the agenda today so people can start getting a feel for some of the changes that we discussed. So at 9:05, we're going to do the approval of the minutes and discussion of the minutes. Then at 9:10, we're going to move to something new, and we're going to talk about what's going on. So it's a community not only update, we want to know what's going on in prevention, meaning new techniques, new groups, new things happening. So it's not just an announcement section of the agenda that we're going to be moving forward. We're looking for much more substance in this section, so we can actually really know what's going on and share that with our communities. So we're calling it What's Going On, and that's for prevention, treatment, recovery. And probably membership will be a part of that. But this is really where the rubber meets the road. We're really hoping to get a lot of substance from this section of the agenda, so that way we can make sure that we disseminate this information to our communities that we represent. We've talked probably for 6 months about equity, inclusion, and what does that look like? And what does that look like for this council? What does that look like for behavioral health dollars? How does this council come together and talk about equity, inclusion, and how do we make sure that we're recommending the best use of recovery, prevention, and treatment dollars to those in most need? So we've asked Francesca to come in, who is a state representative over this department, to start a training with us. And what we discussed is taking a look at the bylaws and taking a look at the work that we do. And over the next 12 months, everything we do is going to be back to the flavor of inclusion, equity, and we're going to keep those thoughts to the forefront of our minds to make sure that we're actually doing the work for the people that we serve. 10:30, we'll have a block grant update. What is the block grant? Who uses the block grant? We haven't had a client profile for years to understand how this money gets used and by who. What do they look like? Who are they? What part of the state do they come from? What type of community? So we'll have a client profile section so people can have a better understanding of what this council does and how your decisions impact people. So I thought a client profile would be really beneficial to everybody today. So the work and discussions we have, you can see that it actually translates down into our communities. So we'll do that at 10:30 today. At 11, we'll have a break. Then we'll go to OBH at 11:10 for their updates. And then we'll say goodbye till another month at noon. So that's the agenda that we have prepared for everybody today. Are there any questions of me or Jacob before we move into the approval and review of the minutes?
Yeah, so I guess one thing, was there some membership stuff that we needed to address? Just thinking about Lloyd, and was there some pieces that we want to get addressed from membership? I think there was an email that got sent out about potential applicants and new members. Is that a process that we want to go through in here essentially now, or because I don't necessarily see it on the agenda, but we're a good spot for that.
We could do the approval of the minutes and then turn it over to Lloyd, since Lloyd has to leave, and Lloyd could supply us with the updates. Is that okay, Lloyd?
Sounds good.
Okay. So I'm going to be recommending a change of the agenda to moving membership committee to 9:07 as an update. Can I get a second and an approval to update the agenda?
Sure, I'll second it.
Thank you. Discussion? All right, the agenda will be updated and moved. So that's the agenda that we have prepared for you today. So let's take a look at the minutes and let us know if you have any questions or concerns with the minutes that are presented before you. Call for the final call of the review for the minutes. There's no objection for final call. This section is now closed. Can I have a second to, I move to approve the minutes.
Second.
Minutes are approved and entered into the record. Next up, we're going to talk about membership. There's a lot going on in membership, and Lloyd, take it away.
All right, good morning, everybody. Between the membership committee and the steering committee, we have decided to delay putting any of our current applicants on that we have. We haven't had a chance to approve them all, but also we need more time to see if we get a few more applications in. So as of right now, we have 4 people with personal experience. One of them is strictly mental health, which is nice for a change. We have 6 treatment providers, but I think 2 of them we might be able to classify as a community partner organization, as they're not licensed individuals. And that's a conversation that membership and steering will need to have as to how that looks in our bylaws and everything else. So we got lots of things coming up with the membership. We're going to bring that forth in November, which will include how the seats look on the council. Possibly we need to bring that before council to see what everybody thinks of it, to try to get some better equity and diversity. The applicants we have right now, I think actually brings that, as we have a person from Colorado Artists in Recovery. We have a person from La Junta, one from Fort Collins, one from Peyton, one from Grand Junction, and one from Pueblo. So normally we don't see that. I mean, normally almost everybody's in the Denver Metro. So it's great to see that we're being able to reach out at least. So I need to ask Donda to update the membership application with the date signed. I'll get that to you on email, and we need to continue to send the application out and try to recruit people we may know, or get it posted in forums that you know. Working with Ryan and the steering committee, we've talked about a need to change some of the bylaws for a couple of years, but what we'll look at for membership next month and may or may not decide will affect how the bylaws may need to change, and that will end result will affect how all the seats on council reflect. So Brian,
are there any questions, or anyone have anything?
Ryan, did I leave anything out for this month?
No, I think that's right on. I just wanted to add one other piece to, so the Office of Behavioral Health with the equity, diversion, and inclusivity conversation, getting things ramped up about getting documents translated into different languages. I put Bhpac bylaws on that list of documents that should be uploaded and translated professionally. So just thinking about that in the future as well, is that if we have documents coming in here that we want to get professionally translated, yeah, keep that in the forefront as well. Just trying to include each one of these agenda items, having that EDI focus as well. And yeah, just thinking about when we do go through that process of updating bylaws and thinking about membership, is making sure that we're focused on yeah, diversity and inclusivity as well.
Are there any other questions of membership today and recruitment? Okay, I'm hearing none. I'm going to move on in the agenda. So this next part is brand new. And like I said earlier, this is really an opportunity to take a deeper dive into what's going on in our community through these domains, and any other type of recovery, treatment, prevention, something that's behavioral health related. So it definitely can be an announcement. We're definitely looking to hear about trainings. We're definitely looking to hearing about activities, like I was following Advocates for Recovery on Instagram as an example, and they were up in the mountains doing a recovery rally and recruitment up in looked like Moffat County. And I was like, wow, that's just really amazing. And I would have never known if I wasn't just flipping through my Instagram feed. So really what the steering committee was hoping for this section is we really take time to discuss what's happening good in our community, or this is also an opportunity to throw out an issue that's not being addressed, because we're going to be working on our membership and have a diverse coalition. So we can also be a problem solving network at the same time, because there's a tremendous amount of people here with knowledge and lived experience that can help one another. So we're going to move into this section now. And I'd like to know from the prevention committee or anyone that's involved in prevention, or you don't have to be involved in prevention, what's going on throughout the state in prevention. Now's your time to let us know.
This is Margie Grimsley, and to be honest, this one, I wasn't prepared for this, and I don't know that anyone else had said, maybe other than Bonnie, about being on the prevention committee. So I think it's important for us to be able to thoughtfully do this, so we will be more prepared moving forward. But I don't know if this fits in or not, but I'm part of what's called the Behavioral Health Partnership, and there are some of the former folks that used to be part of this, Mo Keller, Frank Cornelia, that are part of that. And one of the things that we talked about at our last meeting was a document that Mo Keller had sent out to our group from Senator Bennett's office. And it is his overview and thoughts on moving forward on putting together a piece of legislation regarding mental health. And included in that document was just a piece of saying, where did block grants fit into that? So it triggered my brain thinking that that might be something that would be important for us to be aware of. And because I'm just not tech savvy, I can't do like everyone does and pull up a link to that document and put it in the chat. But if people are okay with it, I will send that to Donda, and then hopefully she will be able to send that out to folks. And I think it's like a 3-week turnaround, but it certainly is something that, as part of the block grant discussion, that seems like that should be something that maybe people would want to provide feedback to Senator Bennett on. And it's like I said, I'm not sure if that's I'm going to make that a prevention topic just because I'm going to do that.
Perfect. And this is brand new to everyone today, so I wasn't necessarily expecting everyone to be ready, but this is something that we'll be doing moving forward. And it's updates on legislative, like you just talked about, community events, new community curriculums, different things happening in prevention from around the state. Is there anything else taking place that someone would like to share within their organizations, recovery organizations, that's happening preventative?
Yeah, Bob. So Jacob here. Margie, you might be interested in the prevention side of things. Colorado Providers Association is going to start doing a lot more outreach in the rural and underserved communities to try to get people certified for the prevention specialists and help going through that process. So as that information develops, I'll pass that along to you all. But it's a great way to develop the workforce in Colorado across the board. So I'll keep you updated.
That's great. Thanks, Jacob. Anybody else have anything?
Oh, I was actually going to amplify Jacob. I obtained my CPS credential this summer, and I have a lot of credentials from a lot of fields, but I would say it's probably like one of the most challenging yet useful credentials I've ever had. So not just for substance abuse prevention, but I think any kind of community mobilization. If you're interested in that field, it's a great credential to pursue. So amplifying that.
This is Margie, and I promise I'll be real quick again. One thing that the Federation is doing is we are partnering with our Jeffco communities that care partners that I think I've mentioned them in previous meetings. And this is a mini grant from the National Federation regarding helping people, encourage people to become vaccinated. And there is a HRSA grant that the National Federation received. And so the Colorado Federation is working. So I'm just, hopefully we'll be able to share some resources. So again, as we get those things developed, I will send that to Donda and she can forward those out. And it might be resources that you will find valuable to use with your families and in your communities. But we also are working with the Jefferson County Public Health. There's an intern program, and they have 3 interns that are part of they're called vaccination ambassadors. So we're hoping that maybe we can even get a video put together that the youth do on this. So it's an evolution and it's going to happen quickly, but I just want people to be aware that you might be seeing those things, and I'll again send them to Donda for you to share with others.
Thank you. Are there any other prevention updates? I have one prevention update I would like to share. We have a program at Mile High Behavioral Healthcare that's called the NEXT program, NXT. And if you would like to follow that program, they're very active on Instagram. Our NEXT program focuses on adolescents, 12 to about, we consider young adults up to about 24 years of age. This is our prevention program for HIV, substance abuse, work with children with mental health. And so it's our LGBTQ plus program, 12 to 24, and it's called the NEXT program. It's virtual. We have some in-person activities, and everything we try to do through the NEXT program is through the preventative lens, so kids don't continue to go down different type of tracks, getting more involved in things they probably shouldn't be. And one of the most exciting things that we're starting with this program is we are actually starting a adolescent peer program. So right now we have 2 peers that we've hired that are between the ages of 12 and 16. And then we'll be hiring 2 additional peers, 16 to 18. So we really believe in that peer model for our early intervention programs. And if you'd like to learn more, they are very active on Instagram. So please follow the NEXT program. It's virtual. Young adults can attend throughout the state. And if you're in a metro area, it kind of moves around. And we do different activities from coffee shop, socialization, to going to different kind of venues. And then 3 days a week, we're in the basement of the center at Rainbow Alley doing different type of preventative activities. So the NEXT program was something I wanted to share. We're doing some really exciting work when it comes to adolescent peers. So let me know if you have any additional questions on that, or you can just simply follow along on the NEXT page on Instagram and Facebook, and you can make referrals into the program through any of your family networks for kids looking for something different than what they currently have. And if they're feeling isolated and alone within their sexual identity, we certainly have preventative and supportive programs for those adolescents. Next, let's talk about treatment. What is going on in Colorado and our treatment community?
Hey, Bob, before you move on, I had his hand up. I don't know if he had something with prevention or not.
Go ahead.
I wasn't sure if you were doing recovery yet or not. I have a few things for recovery, so I'll wait.
I'm going to go into treatment and then I'll go into recovery.
Okay, I'll wait.
Okay. Anything from our treatment committee or Anyone?
I'd like to bring, I want to bring up something that kind of crosses over, I think, a couple different areas.
Perfect.
And is fentanyl testing strips. We are seeing quite a few overdose deaths, an increase in overdose deaths, as I'm sure other people are, related to likely fentanyl, although you don't always know. And I wanted to kind of talk about what's happening in general for different organizations about trying to do more about handing out fentanyl testing strips. I know that I believe in Colorado, it is, I think, decriminalized, but it's not necessarily legal, if that's correct. But federally, they changed some rules at SAMHSA about organizations being able to hand those out. But I think there's still some murkiness in the Colorado law about that. So I wanted to ask if anyone else knew about that, and if there was a way for OBH also to kind of help get behind more effort to hand out fentanyl test strips in different organizations.
I think this is an excellent topic. I don't know enough personally about the fentanyl testing strips. So I think it would be beneficial to have a session on that here at the council. Do you even have one of these in front of you so we can see what these look like, or how are they administered? Can you tell us a little bit more about a fentanyl testing strip?
Yeah, so, I don't have one. I'm at home. I have them in my desk drawer in my office, but they look like a litmus test, really, and people dip it in their product, and it's, I think, 2 lines if it's positive fentanyl, 1 if it's not, something like that. Don't take my word for it. There's a lot of stuff out there on YouTube and whatever on it. It's pretty simple, super great harm reduction step to give to people for testing their product. But there's been conflict in law, which is, I think, why some organizations have really shied away from this. So I would love to have like an expert come and talk to us more at the council here, especially about the legal ramifications for an organization or a person handing them out. I know the Harm Reduction Action Center has been handing them out in Denver for quite some time, but because fentanyl has spread so far and wide, and SAMHSA changed its rules related to federally people being able to hand these out without repercussions, I was hoping we'd start to see some changes in Colorado. And SAMHSA changed this rule, I believe, in March after the Biden administration took over, but I haven't really seen much in the way of increase in this. So just looking to see if other people had knowledge about this more than I.
Hi, this is Angie from Arts. I know a little bit, but really not so much about the law. I know Arts is partnering with Jefferson County Public Health to place a vending machine type product in one of our facilities, which would dispense fentanyl and naloxone test strips. So we had, because we're part of the university, we had to go through the university's legal department and obviously get approval for something like this. And, there's a contract and things like that. But I don't know, unfortunately, the legal side of it, but I do know that this was approved for us. And I don't know that it's in place yet, but we are moving in that direction.
Angie, can you tell us a little bit on how or why or what the intervention is to use these test strips? What would compel someone to use them, or can you give us what type of intervention this is?
I don't, honestly, this is kind of out of my wheelhouse a little bit. I'm just looking at the information that I have in front of me that this came through. This is really Angela, who runs our adult outpatient OTP clinics area of expertise. And I'm not sure, I don't want to misspeak, so I'm not sure.
My understanding that, the reason to hand them out really basically is just basic harm reduction 101, it's like a clean needle exchange, basically. Think of it that way. It's a way for someone to test any product that they have for fentanyl, especially since fentanyl is in more than just heroin now. It's in meth, it's in pills, it's in a bunch of different things. Anything that someone can snort or smoke or take, fentanyl can be in it. And since it's all over the place, it's basically a thing to give to clients for them to go test their product for them to make an informed decision about if they have fentanyl in their product or not, and if they want to continue to use or not.
I got it. So it's not a urinalysis test. You're actually testing the product.
Yes. Oh,
And you're-
sorry. I should have made that clear from the beginning. Yeah, you're testing the product for safety of the user of meth, cocaine, heroin, typically heroin,
Got
but fentanyl has spread to cocaine and meth in the metro area quite widely.
When you did this, I was thinking dipping the stick into the pea and getting the colors. So anyway, I think this is a fantastic topic, and a kiosk over at Arts even sounds even more amazing. So I'm gonna, if it's okay, parking lot this and ask, Angie, would you mind if we put this on the agenda, if Arts can present to us on what this protocol is and what the university is doing? Since you guys do a lot of research and have a methadone clinic, is this something you would feel comfortable asking, Danielle?
Sure. Yeah, I can reach out to Angela. Are you thinking the next meeting or?
Yeah, we could do it in November.
Okay, I'll see if she's available and, or if she's not, if she has another staff that has more information, but sure, I will reach out and then I'll just let you know.
And we'll do it, like this is one of those community updates that I was talking about. So that'll be in the 9-10 section of what's going on in the community. So this is something that Arts can present on. So just let us know if that's a possibility. And then if that can just go on the tickler for next month to follow up on for steering committee, that would be great, Donda. All right, is there any fantastic discussion? Fantastic discussion. Totally, we need to know more about this. I mean, wow. Anything else going on in the treatment community?
Yeah, I got a pretty big update. So the Office of Behavioral Health is working with Mental Health Colorado to try to get the involuntary mental health laws updated. There's a lot of stuff going on within that group. They've created essentially subgroups to talk specifically about law enforcement interaction with individuals experiencing a mental health crisis, and a lot of very, very interesting information has came out about that, and the concerns that law enforcement have related to getting rid of qualified immunity and the effect that has on law enforcement's willingness to intervene when someone is experiencing danger to self. It's been flat out said by law enforcement that we will not intervene. If there's someone that has a plan for suicide and it's not on the law enforcement to intervene any longer because of that qualified immunity is no longer available. So I think that kind of ramps up the, well, wait, how do we get the system into a spot that we have a system that can intervene in a situation where someone is imminently dangerous to themselves, so talking about specifically that Senate Bill 217 from a few years ago, that kind of really threw law enforcement for a loop there. But that's just one piece of what Mental Health Colorado is really now leading that conversation with, about with any sort of involuntary mental health laws. Really the goal needs to be is that is an absolute last resort. The latest information we have is that there's roughly about 50,000 72-hour holds placed on individuals in Colorado every year. That comes out to about 136 holds per day. Those are oftentimes not valid holds or not needed holds. So we need to come up with some sort of plan to get people the care they need in a setting that fits them without being forced into treatment as well. So that's part of this conversation. So if you're interested in that, Mental Health Colorado leads a stakeholder meeting twice a month. The next one is on Monday from, what is it, like 11 to 1:30 or something. Click here. So I can, 11:30 to 1:30, if you're interested in that larger stakeholder meeting. Ty, I know you've been really active in there as well, if you have anything to add to that. Because there's just a lot of pieces within that. And the mental health laws, the 2765 is the specific statutory citation for it. that, I mean, it's about 45 years old, that section of law. So there's a lot of pieces that just need to get updated. One other piece that they're really talking about is expanding what outpatient involuntary care looks like. And how can people be supported and he'll still have pretty comprehensive rights when it comes to receiving involuntary mental health care in an outpatient setting, since there's really no provisions in Colorado law specific for that right now.
Ryan, is it possible for you to reach out and invite them to see if they have some time to come during our What's Going On section to talk about the involuntary process and the committee that's taking place? There's so much work that's being done around this. I think it's really, and we're heading into the holiday season where we get a spike in 7210 holds during this time of year. I think it would be great if they can let us know about their work and how we can be supportive of that work. Getting someone on the hold and keeping someone on a hold and helping them through a hold is extremely difficult in Colorado, and many people fall through the cracks and end up dying. So this is some very serious work that Mental Health Colorado and others are doing, and I think it would be a great update for November, especially being in the holiday season. And I know there's work being done on it. But if you could reach out and let us know and maybe update us in a steering committee, I would love a representative to come talk to us about it. That's some impressive work.
This is Margie. I would also ask if we could also consider in that conversation, when people are released from a 72-hour hold at a hospital, if they are released in a way that I heard of one incident specifically where the person was released. He had no money. Because the situation was he had to leave his apartment with his wallet or his shoes because of a flooding situation, and he was released from the hospital and ended up walking home because he didn't have the capacity to even call someone for help. So I think that's a huge piece. It's not just getting in and while you're there, but what happens when you leave.
That is a very important issue that I think you should parking lot, because I think we can spend a large amount of time on that. What I can tell you, we do this work all the time. There aren't really significant aftercare plans that have any teeth or any real support to them. So definitely something we need to talk about and get educated on how we can support that as well. So Ryan, if you can help us with that, that'll be great. Is there anything else out of the treatment genre that we could have an update on? If not, I'd like to get ready to move on to our recovery genre and world. So recovery next. Go ahead.
I'd be happy to share a little bit about how the Medicaid residential benefit is going, if you all would be interested.
You have go ahead.
Yeah, so it's been a ride, I'll tell you, since January. Just getting
a horrible ride.
Just even getting contracted and credentialed with the RAISE. So those who are not super familiar, a RAISE is a regional accountable entity. There are 4 of them throughout the state. And I just wanted to mention how it's going with Senate Bill 137, Section 8 in particular, basically holding the RAISE and HCPF a little bit more accountable. They have to do some reporting, like audits on denials and that type of thing. So now they're holding an SUD forum they were doing it every 2 weeks or like twice a month. They canceled the one yesterday and they're pushing it to quarterly. So the next one is in January. But there's a lot of information that's coming out of that. A few good things, for example, at least with transitional residential and intensive residential 3.5, They are now doing 14-day minimum authorizations for initial requests, which is great because they were doing like 3 to 5 days. And then you have to do a concurrent review. And that process is a pretty hefty administrative burden on our clinicians. I don't know about 3.7. Maybe Karen or someone could speak to that. I don't think they're approving that long. They really try to get them out of 3.7 pretty quickly, unfortunately. What else? So the HCPUF forums include HCPUF, of course, the RAIs, providers, I think OBH attends. And so they're trying to really collaborate, I guess, and that wouldn't be happening without that legislation. So I feel like that's important that we continue to advocate in that way. And then not to go too much in the weeds, I just wanted to share, because I feel like this impacts other providers potentially. So Colorado Access, they're kind of the big one in this region, right, in Denver and the surrounding metro area. So they recently collaborated with Signal, who's our managed service organization, to do secret shopper calls. And I know that we're not the only organization who received one of these, but long story short, we got a letter of compliance from Signal, which we always have, and then a corrective action plan from Colorado Access. So different standards. And so they wanted a response, of course, to their corrective action plan. And I really kind of dove in and advocated and pushed back and said, like, your standards are not able to be complied with. They want a 7-day appointment from when they call, which would be lovely. That would be really nice if we could do that. But there are wait lists because of the demand, the pandemic. They didn't take COVID into account at all. And so it was a little bit risky. I felt like I was poking the bear, right? Because there's this huge power differential between Ray and provider. But they actually approved it and sort of sent it up the chain to their behavioral health leadership. And I got some answers back that were really vague and like not answering my questions. But I wrote a 3-page like narrative about, you know, hey, we're not making excuses for non-compliance, but here's the context of the environment and why, like, you guys need to adjust your standards to be more in alignment with the current status of the behavioral health field. There's a national, you know, workforce shortage of behavioral health providers. You know, and they wanted us to answer a lot of calls live, which is just really hard. We don't have the funding or the model to be like a call center. So Daryl happens to be our intake coordinator. He does a fantastic job. He gets all of the calls returned, answers a whole bunch of them live. And so we pulled our metrics, right? Like our call metrics to send to Colorado Access and say, hey, like, this is what we're doing. We're able to keep up with it. But even if I had 5 Daryls, because Daryl's great, we still don't have the bed space necessarily, right? You know, if we get 300 calls a week and we have 25 beds available, like, do the math, right? We can't get people in within 7 days, even though we'd love to, other than like priority populations. So just a little bit of an update on that. I'm pushing back a little bit and I'm hopeful that that helps providers. Plus, I was a little bit irritated that we've only been contracted with them for, I don't know, a couple of months. And so we could have had more of a teaching moment, right? Like, they could have said, okay, we're going to do some preliminary calls, and then we're going to meet and tell you what our expectations are. And we could have provided the context and then, right? But they just slapped us with this citation. And I know we're not the only organization who received that from them. So I just wanted to update people on that because it affects lots of providers and just adds more administrative burden. And we're trying to provide direct client care, right? And it takes away from that. So advocating is kind of my big thing. So I'm just putting that out there. If other providers, like treatment providers, want to add something, great. Go ahead, Bob.
Since you brought up something, and I'm going to move us on to recovery to get us back on track on time, but I would like to ask you, since you brought up the levels of care, which have recently changed in Colorado, the ASAM levels of care and how we assess people and how people are placed within different would Sobriety House like to do a presentation on 3.5, 3.7 and educate our council as to the changes that you're talking about, which is how to access residential and the assessment process? Would yourself or one of your clinicians like to present kind of what you're talking about when it comes to ASAM?
Sure, I'd be happy to do
Because
that.
I think it's a little over a lot of people because
Yeah,
this is such a new change, and but it would be nice to understand in a deeper dive how to access and what are the changes to access residential.
Yeah, especially going through Medicaid and their approval process, et cetera. Sure,
Right.
I'd be happy to do
But
that.
I think that would be very helpful to a lot of people. Well, that will be, if you can, just shoot us an email if you have somebody that can do it for next month, but that'll be also in this treatment section of what's going on in our community.
Okay,
And
is that helpful though? Like for context, I don't know.
Yes, there's a lot going on in it. That's why I'm asking to recall it back and have a deeper dive, because the ASAM and the level of care and the access and the approval process is probably something we can make recommendations on for Coloradans.
Okay.
All right, if we're going to move on to recovery, and then we need to get back on track. So let's hear what's going on in the recovery genre in our community here in Colorado. What's up, recovery?
I have one big announcement for recovery and then something that could have fallen under any one of the three. So the first thing is SAMHSA has created an Office of Recovery, if you haven't heard. So just thought I'd put that out there, and I'm sure Ryan knows more about it than I do. But I got an email about it, so I thought that was exciting. The other thing is I'm part of an international summit on peer respite and Satorian houses. And all this month, every Sunday, we're going to have a presentation. Last week we had Bob Whitaker and 3 people from peer respite and 3 people from Satorian houses talk about the experience. And the next 3 weeks, we're going to have the nuts and bolts, how to create these programs, the difficulties, advantages, just how to build these in your community. And then the final week, we're going to have a community kind of get together, networking, discussion day. This is an international event. We've had over 31 countries registered. We've raised over $10,000. We had 231 participants at our last event. It's completely free. It is during a Sunday, which makes it hard for a lot of people to attend. But peer respite is my dream job, and I want Colorado to know about it and know what it is that I want to do. So I'm really inviting people from Colorado. I think we only have 14 people from Colorado attending, and 2 of them are my family members. So if anyone's interested, I'll put in the link to register. All the videos will be put on a YouTube video, so you don't have to attend on a Sunday, but it's just an amazing opportunity.
Great. I'm going to ask if you, at our next council meeting, if you can present on what peer respite is. I don't think anyone knows what you're talking about, and it would be great to have you do a brief presentation. So because this is a new area on our agenda, we went way over time. So the steering committee will make sure that we allot more time to this section, which seems to be pretty popular with some really great updates. But what the heck is peer respite? It sounds amazing, and I'd love to learn more about it. So if we could add you to the agenda in November to present, we would graciously love to hear more about peer respite. It sounds like something that's needed.
It's a wonderful program, and I'd love to talk about it. So thank you.
You're very welcome. Is there anything else from the recovery community?
I'll just mention that we're working with in contracts with our Latinx recovery programs. We have Young People in Recovery as well as Servicios. So we're pretty excited about that. And I think that's it for new stuff. So thanks.
Thank you.
So
Yeah,
Brian Laney here. I've got a question for you, Aaliyah. Maybe you can help me out. As an operator of recovery residences, sober living homes in the state of Colorado, back in 2020, a state law went into effect saying that all sober living home recovery residences need to be, with a few exemptions, need to be certified by the state. And OBH is overseeing an organization called CAR. CAR has seemed to drop the ball. And I'm wondering if there's any type of an update there. Because right now there's, if I would imagine I'm not the only one, but I would imagine that there's a lot of recovery residences operating illegally right now because of the lack of, I don't know, update, please.
There's been a change in executive director. So the executive director is gone, and now we put out an we're filling out applications right now. So that's probably what has happened. Brian, if you want to talk offline about this, that's totally fine. We definitely, like we did in the beginning, we understand that if CAR is not able to come do the certifications, nobody's gonna come after anybody at this point. So we'll be able to sorry, I'm like losing, my tongue is on strike. Okay, so we are going to, I just want to mention that there's no reimbursement money right now. So when we get the RFP back for any certifying body, it doesn't have to be CAR, but we put out an RFP. The RFP is out, then the money is going to be in. So the reason I'm saying this right now is because it's probably to people's benefits, because if you did get certified right now, you wouldn't be getting any reimbursements. And we're putting money into CAR, making it so we can have less, it's not going to cost as much money to do the certifications. So I think everything's fine. Nobody's coming after anybody, I promise.
Yeah, Ali, I realize that. I'm really not all that worried, right? It's more there's an issue with the system. This is something a couple years ago that put a lot of people in a position of having to spend money that they didn't have to make certain, to meet certain standards. And it's all for the good. Don't misunderstand me here. I think, best practices are absolutely best practices. But now we've just got this system that doesn't work, right? To be quite honest with you, I would like to have CAR or whoever, be held accountable, and I'm sure that they are. I'm just, maybe they need to come and give us a presentation to this council and tell us what they're going to do to make sure that we can all meet, the legal requirements to be able to operate as what we are.
I absolutely would love a presentation on CAR. I am not familiar with that whole licensing process of our recovery. So, Brian, if you will parking lot that for January and bring that back up in January so they can get an executive director hired and we can get the executive director to present to us, I think it is a perfect part for what's going on in Colorado for them to present, because I too want to know what the hell's going on.
Yeah.
Is there any other?
Just one thing to be clear is that it's not a state licensing process. So what is funky with this whole process is that OBH's role is to, per the law from a few years back, was to approve a certifying body. So it removed that layer of state oversight and gave it to an external entity, which it's not the licensing or designation structure that OBH does with treatment providers or mental health facilities, right? So then that's the largest disconnect from where. So then it's that piece. But then, I mean, we can provide some kind of what our oversight looks like versus what CAR's specific duty or whatever approved entity certifying body's duty is there.
Yeah, it's a credentialing process. It's not a licensing process.
Yeah,
So,
but this is also that opportunity with the Behavioral Health Administration is that if people have really strong views about what that system should look like, now's the time. Now, there's no better time than right now to come up with a kind of a new plan for how all behavioral health service providers should be regulated or their services be standardized. Like, this is that time to have that conversation.
that's another really massive topic, Ryan. All right, so I'm gonna, if there's no other updates from our recovery community, I'm gonna move us on in the agenda.
Could I just three really super quick things? I know we're out of time. But so as LifeRing Secular Recovery offers virtual support, peer support meetings all around the world. So not just in Colorado, but we've had a huge amount of growth in interest in attendance in those meetings. And I just want to say the reason for that is someone who was a smoker was asked how he was able to not smoke for 25 years. And he says, I still think about it every day, but I always do something to prevent me from getting a cigarette. It's very similar to alcohol and drug addictions as well. So if people lose their connection after they go through treatment, then, they relapse or they go back in. So those are the first 2 points. The last is, has anyone heard of the Awake Sobriety Bar here in Denver?
No.
Yeah, so I'll put a link in the chat. I think we should all go try it. They have jazz and other music and different sorts of things going on, in addition to these fancy cocktails that have no alcohol.
Oh, I think I saw that in the Westward.
Yeah, they've been advertised in places like that. So
okay.
That's it.
We should go try it. All right, so I'm gonna put this part of our agenda to close today. Here is the callbacks. I want to make sure that the council is in agreement with what I heard the callbacks were for our next what's going on in the community. Number one, we're going to have Arts come back and do a brief training on the test strips of product, fentanyl. Next, we're asking Mental Health Colorado to come talk to us about the 7210 holds and where they're at in the process of updating 45-year-old policies and procedures. Sobriety House is going to offer us a training and an update on access to residential and residential levels of care through the new ASAM level system that Colorado has. And then we're going to get a presentation on peer respite. What is peer respite? And then the next callback I have is for January, which would be an invitation to CAR to present on the credentialing and endorsement process that they do. So that's what I have as two callbacks for our next community section of the agenda.
So Bob, is that everything is next month, or are we spreading these out? What's that look like?
That's going to be everything for next month except CAR.
Okay, got it.
CAR will be January. Shoot us an email if there's a problem with that. But we'll create much more time in the agenda since this was a brand new thing that we're doing. Okay, next up, we're going to be talking about equity and inclusion all the time. This is just what I really believe we need to be doing over the next 12 months. What is it? What can it do? Why should things be equitable? Why should we be inclusive? What does this language mean to us in the work that we do in the council? What does it mean for us as community members? What does it mean for us as treatment providers? What does it mean to those of us that are recovery advocates? So we've invited a guest here today to help us start that process. And the process, I hope, will lead into taking a look at more inclusive bylaws, conversations, how our committees are structured, and how our recommendations are made towards the block grant. So Ryan, if you would do us the honors in the introduction to the next part of our agenda.
Yeah, so I'm messaging with Francesca right now. There is some conflicts that came up with her within CDHS. So I think Francesca is going to make it a little bit easier if we can try to move that to November, so she has more time to specifically talk about her office and the EDI component related to CDHS or the Department of Human Services as a whole, if that's okay.
Absolutely.
Okay, so I'll make sure that gets set up, and even if it looks like we're going to have quite a bit of stuff going on, even with the what's going on section of the agenda moving forward. So even if we start having that conversation about the OBH updates, and then we have specific topics within the OBH updates like Francesca, and they come during that section, and maybe we just shoot for that piece.
Yeah.
I think with the what's going on, I think there's a large opportunity there to kind of merge a lot of the stuff that happens all together, so we can have a more cohesive conversation rather than at the end of the last hour, let's just have Ryan talk at us about OBH things. So if we can get away from that,
an hour with Ryan, we can call it. All right. Do you want to do us the honors about block grant information and client profiles?
Yeah, so first off, with the client profiles, we ran into some snags. So with the specific client profiles that we talked about in steering, coming up with who is this specific person that we're talking about, or who are these groups of folks? What we've ran into is that our data and evaluation team is currently functioning at about a third of their capacity. They just don't have FTEs and have essentially zero time for us in things like this. So with that, we need to give them a little bit more time to actually manage that response. So I don't have the specific client profiles, but the block grant information, and really my hope was really to go over OBH as a whole and just high level, this is what OBH is. So when we talk about the Office of Behavioral Health, so we're all clear about what we're talking about here, because there's a lot of pieces that the foundational aspects of OBH, if this group is understanding that, it's, I think, going to be a lot easier when we have all of these complex discussions that are going to be happening over these next 4 to 6 months when we talk about the Behavioral Health Administration. There's going to be a ton of moving parts. There's going to be a ton of, there's still a ton of unknowns. We do have some pieces that we kind of know are starting to happen. So once we talk about the Behavioral Health Administration and the plan that Health Management Associates needs to come up with, that is due November 1st. We have some preliminary stuff that we kind of know what's going on, but we don't have that plan in hand. For instance, one piece, and which I may be stealing Bonnie's thunder here, is that there is an initial proposal within that plan to have OBHs, so the Office of Behavioral Health Prevention Services, moved under CDPHE, the Department of Public Health and Environment. They have a bunch of prevention services, a bunch of prevention programs underneath a different state department. So that's part of this preliminary plan, and potentially a move from some of OBH staff to a different state department. Bonnie, do you have anything to add to that? But it's obviously one of those very preliminary stuff. It's probably stuff that maybe I wish Donda wasn't recording this meeting, but hey, like, now, right? So Bonnie, do you have anything to add to that? I mean, you're more involved in the specific discussions between state departments there, but.
Yeah, I think it is preliminary. And so I keep joking that I'll believe it when I open my CDPHE computer. But I think, no matter the outcome, it is resulting in us. We already collaborate a lot with CDPHE, and it's resulting in further collaboration. So even if we don't move over, I think getting to know the other agency and the other team more is always a good thing. So yeah, I think, whatever happens, I think it'll be a positive strengthening of the relationships.
Yeah, and then I'm going to share my screen here to talk just briefly about OBH, and then we can go into block grant a little bit further from there. If you can make me a co-host, Donda.
Bonnie and Ryan, just to clarify, so would that make preventions, but if preventions would still be part of the Behavioral Planning Advisory Council and our role with that, it just, or we wouldn't take prevention out of the block grant discussion, correct?
No, so those are the behind the scenes pieces that are still in the works, is that there is still that 20% set aside for prevention services within the substance abuse block grant. So there needs to be some coordination. We don't necessarily know what the funding distribution is going to look like, and is that because my understanding is that the Behavioral Health Administration and the majority of OBH's stuff is going to be moving, or the community behavioral health underneath OBH will be moving to the Behavioral Health Administration. So there's still a ton of behind the scenes work about what the funding lines moving to a different department will be. And that, to me, that it's still going to have to be some level of, okay, this is a block grant percentage, and what is the oversight from Bhpac look like for that specific percentage, because that's a federally required percentage, and to ensure that we're meeting the federal requirements that are required of the block grant, like what does that look like? And there's still just a ton of stuff going on in the details of that. But great question, Margie. Like that's exactly the stuff behind the scenes that still need to get figured out.
Good luck.
Thanks. All right, so I'm going to just go over this. This is just an OBH one pager, just so we set the foundation for what we're talking about. When I talk about OBH, oftentimes I am more focused on community behavioral health, but OBH is really that umbrella office that covers community behavioral health. If you think of these as separate divisions underneath an office, community behavioral health, forensic services, and the mental health institutes, we in Bhpac are underneath community behavioral health. So OBH covers those three. Is when we talk about the mental health institutes, the Colorado Mental Health Institute at Pueblo and the Colorado Mental Health Institute at Fort Logan. Those are also administered and run by the Office of Behavioral Health and OBH specific staff, but that is not part of block grant planning. That is completely different, completely state funded, not a block grant thing. A piece that comes into focus there is that really block grant planning and block grant funds are really to keep people out of the institutes. So that's where it kind of draws that line, right? Is how do we get people out of the institutes to community-based services and keep people from going to that essentially highest level of behavioral health care in Colorado. And then just a quick note on forensic services. This is also not really a piece associated with Bhpac. This is really about those individuals that have been charged with some sort of crime and they have been found, or there's some sort of court process that happens that says they have some sort of behavioral health thing going on, and they need to be found or evaluated for competency in their ability to stand trial for their charges. So OBH through forensic services also manages that whole process. So both the competency evaluation as well as competency restoration. We will get a little bit lower on this page. We can talk a little bit about funding of each. We talk a lot about funding and focused on block grant funding, but I think there's a big opportunity to talk a lot more about funding and what the behavioral health system, specifically within OBH, funding looks like well beyond what block grant funding is for. So with that, it's really OBH is that entity that is responsible for overseeing and regulating the public behavioral healthcare system. I think there's a lot of fracturing that happens, and that is really what is driving that new planned behavioral health administration, this new accountable state agency that is really accountable to work or have a bunch of different departments work together. And that's really the piece. That is a massive unknown. But with that, there's a massive opportunity for an organization or a group like this to come up with this is what this system should actually entail. This is, I mean, just thinking about the conversation we just had about the credentialing of recovery residences, like, should that be a more formalized state process? I mean, that's a conversation that, I mean, a group like this could really drive. But I'll kind of leave that to the group as a decision there. So any general questions related to OBH and how the current structure is? Don't see any hands. So then when we talk about funding, so this is funding that essentially just ended the turn of the fiscal year. So the July 1st was the new funding cycle. So this is what funding looks like for really these three divisions within the Office of Behavioral Health. So this is what we're talking about: community behavioral health. I mean, about $250 million worth of funding. So when we talk about federal funds, which are block grant funds and the COVID relief funds, I mean, for last fiscal year, they totaled $86 million. I mean, that's like a third of what the total community behavioral health funds are. So that's when I'm saying that there's a larger opportunity than just focusing on block grant funds for Bhpac, right? Because there's a lot of other funds within community behavioral health, within the Office of Behavioral Health, that really are there to kind of do similar things as the block grant. Is what does a community system look like? And so with that, so this is what we're talking about, substance use prevention grants. That's really part of those federal funds. There's not a whole ton of state funds going into prevention grants, but to talk about having a larger pool there, combining services with the health department. I'm not going to go over all of these lines, but just thinking about what community looks like versus forensic services, which is $34.5 million. And then the mental health institutes, this is running 2 hospitals for about $130 million. This is the 2 state hospital funding. So when we think about what OBH looks like, it's predominantly the funding is community-based behavioral health services. And that includes, so what we're talking about is, what's that, over $400 million worth of funding for the Office of Behavioral Health. So that's, I mean, it feels like maybe a kind of beating that drum of, you know what, we can talk more about than just where block grant funding goes. And this is kind of what I'm talking about with the other funding pieces to this, and making sure all of those funding streams align together and are working together to create a system that works for everyone in Colorado. So questions about that and kind of this funding of general funding for OBH.
Brian, this is Margie. I just want to be assured that child and family are included in, so like criminal justice, it's also oversees juvenile justice. So even though the language isn't necessarily saying child, adolescent, young adult, they are funded through this within these programs.
Yep. So, I mean, you bring up another good point, Margie, is that child and family services are kind of scattered throughout. So if we think about behavioral health services and funding for behavioral health services being scattered across, I mean, it's even worse within the kids system. There's a lot of, with kids, it's more county involvement than traditional adult or older adult services. So it adds that next layer of complexity for the kids system, which that's what the Behavioral Health Administration also is tasked with figuring out is what does the kids behavioral health system look like? Is it an offshoot of the adult, which I think that's the wrong approach to go. It should have its own continuum of services, its own oversight, its own everything, because kids aren't just little adults. They have their own set of needs and concerns. So that's a part of this whole conversation with as we transition to a new oversight system, is that kids have to be a focus and a focus on themselves. So it's not just within criminal justice services, there's an offshoot of kids. Like, no, there needs to be kid-specific criminal justice services and stuff like that. So having that voice here, having that youth voice, having that family voice, I think is very, very important to all aspects of when we talk about policy, when we talk about what the system should entail. I mean, we need to focus on that and not just a general blanket, oh, this is the behavioral health system that works for everyone, because we need to make sure that it works for everyone. And like I said, kids services are very different than adult services.
Well, I agree. And if it's not written, if it's not seen, it gets lost. It's been my experience.
Yeah, so this is just a general fact sheet of OBH. Like, so all of the behind the scenes stuff is that's the piece that's, I think, us as a council need to make sure that we're continuing to stay focused on, in addition to the EDI stuff, is that kid specific services, and then how are we tracking these things? How do we ensure that service delivery is happening? How do we make sure that there are clear standards and that ultimately reduce provider burden, because there creates access issues. If we just put all of these requirements on our providers, then yeah, that takes time away from delivering services. So all of those things that really aren't addressed here are 100% on the table with coming up with what a new system looks like. And this may sound daunting. This may sound like, oh, this is way too big of a thing. It is daunting, and it is a huge task. And this is one of those pieces where I talk about an opportunity. This is going to be hard. This transitioning to anything is going to be very, very difficult. And that's why an organization, an entity like Bhpac, I think, is imperative that it's not just a bunch of state personnel and state legislators making all the decisions about what service delivery looks like. It needs to be way bigger than that, because you all are the experts, and we need to treat you all as the experts of the system, because you all have had your own experience within it. So, I mean, I think that's where empowering groups like this, empowering advisory committees is going to be a key thing for OBH moving forward, and as we transition to behavioral health administration. So thinking or looking at individuals served and numbers. So, I mean, 128,000 folks receive mental health services through OBH's system. About 40,000 receive substance use disorder services. This is treatment and withdrawal management services. We've previously talked about recovery services. We don't have a bunch of clean, good data collected. I think we can have all the discussions about why, right? I mean, I think there's a part that, going back to the conversation about recovery residences, that's essentially a removed from the state oversight piece, and part of regulating treatment providers is that aspect of data collection that comes with OBH regulating those providers, which we don't necessarily have that, or we don't have that with some recovery organizations. Including recovery residences. So then when we talk about forensic services, a little less than 2,000 folks go through forensic services. It's the other division or a different division. And then patients served at the institutes, those two state hospitals, about 12,000 folks. So, I mean, those are pretty big hospitals, but kind of that last piece, and that, as we've talked previously, is the Pueblo. The Institute at Pueblo is our big state hospital that is essentially only a forensics hospital. They don't accept from the community civil individuals, so you have to have some sort of court involvement to get into Pueblo, which I think we can all identify creates a rather large barrier to kind of the whole continuum of services if we don't have access to state behavioral health beds. And then talking about who OBH contracts with, we have 146 community partners, some of them including community mental health centers, crisis service contractors, county jails. That's where we were talking about jail-based behavioral health services. We contract with 46 county jails, organizations working on other grants like the state opioid grant, and then 27 STD prevention grantees. So obviously you don't see in here MSOs. Crystal talked about managed service organizations that oversee the regional component to substance use disorder services in Colorado. We can have a larger conversation about what that structure looks like, but not necessarily ready to go into that today. So when we talk about the Signals of the world, like they are a managed service organization, but also wear a bunch of different hats within the behavioral health system. Yeah, and then when we talk about licensing and designation, this is state licensing. So OBH specific staff going out, entities meeting our specific rules. We license 652 substance use treatment sites. Keyword here is treatment sites again. Those are treatment specific sites. This has been updated. So now there are now 18 community mental health centers because there's a new community mental health center in Eagle Valley, and then 38 mental health clinics, and 109 sites for mental health holds and certifications. So that's when we talk about 2765. So Title 27, Article 65, we also have that process of approving, we call designate facilities to actually provide the involuntary mental health services to individuals on 72-hour holds or court-ordered certifications. So that's where that 109 number comes from. So thoughts on general numbers here, kind of initial perceptions. Do you think numbers would be higher, lower? So when we talk, or even just talking about money, this is specific to OBH. This is not funding from, say, Medicaid, the largest behavioral health funder of behavioral health services in Colorado. So this is only OBH funding on this document, which I can share with folks as well. So initial thoughts here about what these numbers look like. And
I think the numbers are really low for the Institute.
With patients served or the money?
With patients served for the money. You're talking over $100 million and you're talking about 1,100 people. That seems unequitable. So just do the math on what that cost per day with 1,100 people. And we have a mental health crisis in Colorado, and we need much more residential and inpatient longer term care. I can't believe it's $1,138 for that amount of money. I mean, 1,138 people. It's just shocking to me.
Yeah, and if you're interested, we can pull the numbers about how long folks are in the institutes, because it's not a quick turnaround by any means, and that is what drives that number, right? So there's only a set number of beds that the state funds, because it's essentially completely state funded, and that people are there for potentially years and years, which I think that's a large reason for the low number, because bed turnaround just doesn't happen a whole lot. So my specific role, I don't work specifically for community behavioral health. So me as a policy advisor cover all three divisions. So with that, I mean, I think there's I have a little bit more access than I think some people within OBH or some staff within OBH to get information from forensic services and the institutes if we want it. So I just kind of put that out there as well, as that I don't work specifically for me personally, don't work specifically for community behavioral health, as that's just part of my job as well. So it's 10:30 right now. Do we want to take a quick break here and then we kind of incorporate OBH updates and specific block grant information into?
Yeah, I think that's a good idea, that we can take our 10-minute break now, and then come back and talk a little bit more about block grant, as well as OBH updates. All right, so let's come back at 10:40. And we're back. Y'all charged back up, Ryan?
Hey, Ryan, I wanted to make sure I pointed out, Lorraine put a note in the chat for you about the 29,386 people who received SUD treatment and withdrawal services.
So they're included in the total dollars?
So I was just saying that it's more than the 1138 that I think was mentioned as the total patients being served for those huge amount of dollars. That's all.
Yeah, so the 386 would be from community behavioral health kind of funding line versus the 1138 for the mental health institutes would be the mental health institutes funding.
Oh, okay.
Yeah, so like when I can share my screen.
Different buckets of money.
Correct.
Different pots, absolutely.
Yeah, so like both of these, the 127 or the 128,000 and the almost 40,000 would be the $248 million bucket compared to the 1,138 is the mental health institutes bucket.
Okay.
And so that's what Bob
Thanks.
was getting at, is that the cost per individual for the institutes is extremely high, right? Because there's only this number of patients served for $130 million worth of funding for the 2 state hospitals.
I got it. Thanks for the clarification.
Yep.
And then you look at the money that is being served in other divisions, thousands and thousands and thousands of people. So if you're thinking about structural change, or you're thinking about equity of dollars and monies well spent, you would spend your time looking at the institutes, is what I'm saying. So where are you getting your bang for buck in behavioral health? Now, of course, you need institutes based on, the gravity of people clinically, but, can we be doing things differently in Colorado when you have that amount of people receiving that large sum of money? So very interesting debate, I think it is, but we can move on.
Yep, and I think that conversation goes nicely to, so this is the, which I can share this, the 2020 statewide behavioral health needs assessment. So this is just the snapshot, the 18-page one. But I think the piece to look at here specifically is the challenges to the behavioral health system really being about separate and uncoordinated, lack of a shared vision, there's fragmentation, there's parity issues, and then there's workforce shortages, there's administrative burden, there's lack of integration. So those are all the pieces that, even if we think about just the funds from the institutes, is that if we don't have that robust community-based system that has the step down services, less people can get served at the institutes if we don't have anywhere for them to get discharged to across the state, right? So we hear a lot from the institutes about there's barriers to discharging individuals from the institutes because they need higher levels and complex services within the community that some communities just don't have access to. So that's a conversation that is happening with the Behavioral Health Administration and what the Behavioral Health Administration needs to be for, as well as you hear us reference a lot, Senate Bill 222 and setting up that safety net system and high intensity behavioral health providers, and actually funding providers that to a level that is sustainable providers to provide those very comprehensive services, those wraparound services, those assertive community treatment type services, those ACT teams, to ensure that we have a robust network of a whole continuum of services in essentially every part of the state, or individuals have access to all those, because then if we can get more people out and served at the institutes, this number maybe goes up. And I mean, the cost to running the institute would potentially stay the same. It's just more people are being able to cycle through and get the high intensity, highest level of inpatient services that they need, and then can go out and get the rest of their services in the community. Back as President Kennedy in the 60s envisioned with deinstitutionalization, we're still having that conversation right here, right? And that was from the 60s. So, I mean, honestly, not a whole ton has changed, because there's also research that shows that with deinstitutionalization, individuals with behavioral health concerns ended up in jails, right? So we need to figure that whole, where are people receiving services for behavioral health disorders? It used to be institutionalization, which, I mean, I think we can all agree that institutionalization didn't work, and kind of the patient rights aspect of institutionalization, but there's also that people with behavioral health disorders ending up in jails, is that the right spot for them either? So that's also a conversation that I think needs to be forefront within here, is that how do you get access to behavioral health care? And it shouldn't be the first access is the criminal justice system, but that's my soapbox. Yeah, I'll share all these with you, all of these documents that, so you have them in one location, or we can put them in the minutes, Donda. But this is another one pager about the federal block grant funding. So obviously it's been a special 18 months, couple years now with funding for from federal funds. So this is a one pager that was really designed to identify all of the additional block grant funding that we get. But I thought this was a good example of when we're talking about block grant and funding, what it means, and really what what different funding streams look like. So when we talk about block grant in the context of Bhpac, we've predominantly talked about, when we reference block grant, we were really talking about two separate block grants, the mental health block grant and the substance use prevention and treatment block grant. So that's the acronyms, the MHBG and the SABG. Yeah, I mean, so just like Colorado, the federal government is bifurcated between funding for mental health services and funding for substance use disorder services. There really isn't a behavioral health system from the federal regulations or laws, as well as they're not in Colorado for Colorado laws. So there is still that bifurcated system. So if we talk about a behavioral health system, we still need to fit what we're talking about into a system that has specific mental health laws, specific mental health funding, and specific SUD, substance use disorder funding. So I think that's a key piece that we need to continue to focus on, is that it's not a true behavioral health system. I don't think we can really even argue that it's a behavioral health system, because those programs that are behavioral health programs that do mental health services and substance use disorder services, I think some of the providers on Bhpac are well aware of this, is that funding for those services is difficult, to say the least. And we hear a lot about, well, wait, what does this diagnosis mean? And what does it mean if the primary diagnosis, and what does that mean for funding and access to services, and who we actually pursue funding and service coordination for? I think that's kind of part of what I took from Crystal's comments about RAISE and funding through RAISE and oversight from RAISE, those regional accountable entities that are Medicaid's payer or intermediary type entity, and then the MSOs, which are their own payer intermediary, that they have different standards that kind of do the same thing. So there's a lot of fragmentation, and that's just talking about SUD services. So when you throw in mental health on top of that, honestly, good luck, providers. Like, we have done nothing of service for y'all over these last few years, but hopefully we get that figured out. So with that, federal block grants, it's money we receive from the federal government. These block grants that we're talking about are we don't have to compete with other states for them. As long as we get the application in, we will get access to the money. We don't compete with other states. They have a set aside specifically for us, and that's that application process that we just went through. So on this table, this bottom line here, that federal fiscal year 22-23, that application that we just submitted recommendations for was for the application for funding in federal fiscal year 22-23, which was $14 million from the mental health block grant and $29 million from the substance use prevention and treatment block grant. So that's what we're talking about when we're talking about block grants, is these combined, right, for $43 million worth of funding. But when we think about OBH as a whole, and we're talking about $400 and some million worth of funding covering those three divisions, what's that, 10%? Of the funding for all of OBH. So that's kind of reiterating that there's a larger opportunity than just focusing on block grant within Bhpac. So obviously the mental health block grants, they went up. These, I mean, $1 million for mental health stayed the same for substance use, but this is the ARPA, the American Rescue Plan Act. So that was that second round of stimulus from the federal government that got that OBH was awarded $23 million for the mental health block grant and $28 million to be spent by 2025. So there's a lot more money within block grant just from that. And then the first round, there was a supplemental appropriation to the block grants from the first round of the COVID recovery funds for $16 million and $27 million, which comes up to the $179 million over the next 4 years, specific to block grants. These were just additions. We didn't necessarily even have to apply much for them. It was essentially a formality to send in, like, yes, we want this extra money that the federal government put into the block grants. Like I said, it's non-competitive with other states. So as long as we submitted the application, we got the money. So that's why I'm saying that the next few years, there's a lot more money than there normally is within even the block grant structure and behavioral health service funding as a whole. And so this is OBH specific funding. We've also talked about the behavioral health transformational task force from the legislature, assigning or coming up with planning for an additional $450 million worth of behavioral health funding in Colorado. That is different funding than this. That the $179 million that is on this is not included in that $450 million. That's additional funds that the General Assembly has control over and coming up with plans for. So, like I said, it's tough to transition to a new, but if there's going to be a time, this is the time, right? Because there is additional funding in there. And the piece is that how do we ensure that all those funds are coordinated together and working in the same direction is part of the difficulty. So thoughts on that, questions, comments, concerns about block grant funding, kind of how we fit in?
Ryan, this is Margie. I just want to clarify on the page we're looking at, in where it's defining the mental health block grant and the substance abuse prevention and treatment block grant. Do the terms support prevention, treatment, and recovery services, are they just specific to the substance abuse prevention and treatment block grant, or are those same terms integrated into the mental health block grant? So that, I mean, I know we have taken the two together and made those for example, the subcommittees and whatever, so it's, but just within the block grants themselves, are those carved out separately, or is support, prevention, treatment, and recovery language in both of the block grants?
So
I mean, did
they are
Colorado
separate.
by combining the two, substance use and mental health, into the behavioral health block grant, did we also combine those pieces, or was there anything separate in the mental health block grant that was more specific to mental health, or that was unique to mental health?
Yeah, so the answer is both. So federally, there are different requirements for each block grant. In Colorado, we have combined them together to think about, I mean, it's about community-based services, so it's not about inpatient, and that's a piece from the mental health side, because it's the mental health block grant, which was created first, was really about the how do we fund community-based services after deinstitutionalization, right? So it's access to community-based services that support an individual in their communities. We're not paying we can't pay using mental health block grant funds for inpatient hospitalization because it's about community-based services. So that's specific to mental health. Substance use has the prevention specific services. The 20% set aside is specific to the substance abuse block grant, and they have more of the treatment, and they don't have specific recovery focused in there, even though they've now created a new Office of Recovery within SAMHSA. But that is more specific to the federal requirements of the substance abuse block grant. So then in Colorado, with all of our funding, it's kind of piled all together, braided all together, and we've come up with there's prevention, treatment, and recovery that kind of works across the whole behavioral health continuum, whether it's substance use or mental health, and that's where it's kind of came together. So that's why it's a both answer for Colorado. And so that's the other piece within the mental health block grant. Bhpac, or an advisory council, is specific to and outlined in the mental health block grant in federal law. So there isn't an advisory council specific to substance abuse block grant requirements, because that's a mental health block grant requirement. We've worked it out with SAMHSA SAMHSA advised states to combine the advisory councils into a behavioral health advisory council, not a specific mental health council that federal law states. So it is a both.
I guess, and I guess what is just very important from my perspective is that we don't lose that community-based services within. I mean, our focus has been so on prevention, treatment, and recovery. And I think from the mental health world, and especially from the child and family part of the mental health world, that community-based services, that is equally important, because, and it's for everyone, but we have to have ways for people to transition or to be treated and cared for in a community when we do not have, when we're working so hard to not have residential settings, for example, and limiting the amount of time that we're in places. If we don't have that strong community-based part, it has to be a focus from my perspective of the work that we do, because it is, I'm just too many people are not having their needs met because they just don't have the services provided to them in their community. And it's broader than just having your therapist appointment. It is all those pieces that have to be in place within a community for people to be able to successfully survive. And I'm sorry, I'm hearing too many horror stories where people just, if we have this money, how can we use this money to ensure that we really are meeting the needs of those that are out there struggling? So.
Well, that brings me back to a callback for the notes on OBH, which is our inclusion, presentation, which we will have, that I still would like to work towards a client profile. So what you're talking about, Margie, is who are these people and how are they getting access to this money, and what is the system of care that they get access to? So without us really understanding who we're representing and how we're representing them, it's hard to make decisions. So the client profile and how these dollars get spent and who accesses them, I think is a very important piece to the conversation, so people understand that all of the decisions that we are making are going towards indigent care type services or gap related services. And we're talking about a lot of state funded programs, Medicaid, block grant funded, but then there's your whole private insurance care, behavioral health system of care in Colorado, which is also very interesting, outside of this public funding type of conversation. So there's two worlds: public funding, behavioral health, and then the private sector. So there was a hand up with Natalie.
Yeah, that's me. Thanks, Bob. Hey, I put the question in the chat as well, but I guess I'm wondering, what is the difference between peer-based recovery support services and peer mental health services? Those are listed within the two rescue packages or stimulus packages, the CRRSA and the American Rescue Plan. Ryan, do you happen to know the difference between those?
I mean, I can get our program staff in to talk specifics about what the programs were specifically funded and why they're different.
Okay.
Called out.
Okay.
Yeah, I'll put that on my list about these key projects and investments, and clearly identifying what that is, what this means, and what the service delivery and requirements are of those projects.
Okay, I want to add that I agree with both what Margie said wholeheartedly regarding the community-based services, and thinking about those rehabilitation and recovery supports of employment, peer support, drop-in centers and clubhouses, having those supportive places for people to go. So I think we just need to figure out within that client profile, Bob, where all of those pieces really fit. So thanks. That's all I had.
Thanks, Natalie. That's exactly where I was trying to go with that, is once you get a client profile, what I'm hoping the commission can do over the next year is understand the mapping and how clients move through our system of care or not. And if we don't understand how people transition or enter, that goes to equity. So that's part of the conversation today. So if we have X number of dollars and we have this system of care that we're supposedly trying to build or improve upon, I think it's in our best interest as an advisory council to understand how to put forth recommendations to the powers that be, looking through client profiles and understanding how best to advise how to use these monies based on 51% of this commission will be people with lived experience, and we'll be changing, a lot when it comes to membership. So I'm excited about the client profiles, and I think it's important for all of us to educate ourselves as to who's accessing this care and how we can be advocates for them. So are there any other updates from OBH, Ryan?
So that was more related to that first agenda, the block grant information. I have just general other stuff that we also talk about or go over. MHGCJS task force with the Ty is our rep on, as well as the State Rehabilitation Council, which is Lorraine.
Great.
Updates from either one of them?
Yeah, we can move into the next segment now.
Oh, sorry. I have a little dog to take care of here and had to step away. But so the State Rehabilitation Council met on the 15th, and I guess the big news out of that meeting is that Sheena, the chair, or actually the manager of the program is moving out of state and stepping down. So Ryan, you probably already knew that. And I guess they're looking for someone to take her place. You didn't know that? Well, she said that on the 15th. And kind of some highlights from that meeting were that Kristen Korash from the Department of Voc Rehab said the wages for employees they work with or patient, or I'm sorry, they call them person we serve. The wages are up to $16.68 an hour, and which is great. And the measurable skills gains, their goal was 21.3%, and it's actually 31.7. So really good growth or outcomes there. And then they had a presentation about augmented reality, which is a really interesting thing when we think about this diversity and equity. That's it's really expensive, but it's a really great tool to show people unfamiliar with the task how to do it. And so that was really an interesting segment of that. And then the employment first, which is the part that I think applies most directly to BPAC, said they're redrafting their bylaws and going to review their business relations and marketing site to, better their outcomes. So that's pretty much the update from the SRC. Any questions? Okay.
Bob, you're on mute.
Thank you. If there are no other questions, does Ty have an update?
I do. The mental health that I think it's MHDCJS task force met a couple weeks ago. We have new leadership now within the task force as a whole. And that's changing a little how we're meeting and how we're doing things, but in a good way. We are had a presentation about peer services and acute care settings, and talking about kind of the roles of peer services and how to keep the integrity of peer services while making sure people maintain safe and protected. And then we had, and I unfortunately wasn't able to attend this because it was during class. There was a test of some legislation testify about the committee, in which the committee is talking about what bills we are working on, what's important to us, and trying to provide that information to legislators. So there was an update around that. And then we spent the rest of the meeting talking about the development of the bills that we're going to do over the next year. There's several from the Housing Committee, I believe 5. I wasn't able to track down which ones they are yet. I think they're still being developed. The Data Committee is working on, and this is what Ryan was talking about earlier. There are stakeholder meetings to talk about first responders, 811, and I'm sorry, criminal or first responder holds, and making sure that things are culturally competent. they've been working with CCDC to host these events. And if people are interested, next time one comes around, I can send it to the group. They've only hosted 2 so far. I was a part of the first one. I unfortunately had to miss the second one. Finally, we talked about maybe reformatting the committee a little to include stakeholders that should be a part of this committee and be a part of the task force. So that's what I have for an update. Are there any questions?
I'm not seeing any questions, but thank you so much for your update.
Yeah, thanks, Ty. And just one more piece there is that with the task force that Ty represents Bhpac on, yeah, they inform that legislative committee that then has the ability to run bills related to what the task force comes up with. So I would imagine in the next couple of weeks, we'll be seeing what those bills actually are coming from that legislative committee. So it's really that time right now is that we'll starting to see some of the ideas that these interim committees had. So Ty, thanks for that. I know it's a lot of work going through a lot of the in the weeds work with a lot of different things. So yeah, thanks for your participation on that. And Lorraine as well, is that, yeah, with any additional counsel, I mean, it comes with a yeah, a lot of learning and a lot of information to gather. And so, yes, I definitely appreciate your involvement in those. So, and thanks for reporting out on those. So with that, some additional updates. Like I said, this is really that time when we start seeing those drafts, those bill drafts. It's the start of this. It's really right now is the start of the session, even though the session doesn't begin until January. Yeah, I mean, we'll start having bill stakeholder meetings with legislators, I would imagine, shortly. So which we can talk in steering committee about how we want to manage the legislative updates during essentially probably starting in November, going all the way through the end of the legislative session and beyond. But we can talk about that in steering about what that process could and should look like. But does anyone have any ideas about what that looks like? Last time it was me doing that dossier of a bunch of behavioral health bills, but I would be completely open to thoughts on what that would be. I think prior to that, like Frank from CVHC and Mo from Mental Health Colorado provided legislative updates, and I think there was a legislative committee even that talked about different bills as well. But just thoughts, throwing that out there as a kind of a talking piece that at the very least, I'll bring it up at the steering committee this month. So
this is the year that I guess I can update the commission on. Our council on is for our subcommittee work that we do. We're going to be doing it all together, so we're all cross-trained on what we're doing, and so we all know each other's content. So this year we're going to be working together in each subcommittee, and then when there's breakout time, people on those committees will go back out and to do that work. So I think for legislative, and I think what's difficult is I guess I'd like us to really have the ability to participate in the legislative process. This is a community-based council. So I think the information, instead of it coming at us, that it needs to be shared with us in a way that we can ask questions and provide feedback. A lot of the time it's just kind of at us, and so I want to make sure people have, and this is all part of equity inclusion, that we have an opportunity to provide feedback. So as Mo and Frank and others that are coming, I would hope that we are prepared prior to these meetings so we can develop feedback and have this council body review this information in a way that we can give information back as these processes are still being negotiated. So I'd like it to be a little different than just a top down, this is what we're doing, and to be more included in the process. So if there's a way, Ryan, we can know earlier, and then on the agenda, we can plan a discussion period where either sponsors of the bills or staff or OBH can hear feedback and bring that forth. I think that would be another way that our council can be of help.
Yeah, I mean, I agree with you with that. I mean, the problem we're going to run into is that the executive branch is very removed from the legislative branch. So it is bill sponsors and the General Assembly that are driving the majority of the bills. 100% if there's department sponsored bills that we are the ones running those, absolutely. But that's a max of 5 bills coming from CDHS. So that's a very small number of bills that other than that, it's really working directly with the legislators, which we don't have that mechanism as a pass through.
Or getting feedback to CBHC, which is Colorado Behavioral Health, the mental health lobbyists. I'm just saying that there should be a way that this body of people has an opportunity to give feedback, either through sending a letter or I think we just have to talk about this as a council, that it's great having a legislative update, but it's also really frustrating knowing that you're sitting with 50 plus people that have expertise to provide some feedback. We don't have the opportunity to really do that. So I guess we need to discuss how there can be a feedback loop back out of this body of seated people is all I'm saying. So however that looks, I'd like us to have that conversation.
Yeah, sure. And yeah, I think that what I'm getting at is that conversation needs to be about where does that feedback actually go? And because I don't want it to die within OBH because we essentially can't do anything about it because it's not our bill, right? So that's the key piece for me is that's where I agree.
And Ryan, it can be simple as a letter being sent to someone from us that I do in other councils and commissions throughout the state. And where we insert ourselves is sometimes by sending a letter to those people, letting them know a list of our concerns, their feedback. I just think that'll get more buy-in for people that want to join this council, and it gives people the opportunity to be included and feel that the part of what they bring to the table is shaping behavioral health in Colorado. So it's just all part of what we'll be working on this year, is maybe crafting a little bit more responses and being a little bit more proactive than just kind of getting information and sitting and wondering, wow, that doesn't really sound like it's going to work. Us real people on the ground. So I think, I want to empower all of us to be more forthright with feedback.
Mm-hmm.
What else does OBH have to share with us today?
So just some updates on the 2021 bills that passed and had specific stuff. First off, that peer support professionals, those are those recovery support service organizations that the Office of Behavioral Health is required to set standards for. Not every recovery organization, it's not a licensing requirement, it's not a credentialing requirement, so that if a recovery support organization wants the ability to pursue Medicaid reimbursement for their peer services, they would need to meet the standards that OBH will be setting. We are hiring a new FTE. I think that position description was approved, and I think we're going potentially through the hiring process soon, I would imagine, to help out with that process. And those rules need to be ready to go by, I think, July 1 of 22. So be on the lookout for that. We'll make sure that during that rulemaking process is that Bhpac is really involved in what those standards look like for those recovery support service organizations that want to essentially have access to Medicaid to reimburse for peer services. We haven't started drafting those. We're waiting on that first hire so they can be involved, because this will be their program to oversee. But I'll keep you informed on how that process looks, and potentially even bring that new person once we get them on board, so you can see their face.
The rates are dismal when it comes to peer-related services. So, for the recovery organizations that are going to start doing Medicaid billing, the cost of doing the billing and getting the claim submitted, and if the claim is denied, the work to get the claim undenied, you have just spent all of your money working on the claim and you have received nothing. So there's going to have to be a lot of advocacy work that comes out of this council to get those rates to a better and helpful rate for our recovery organizations. We can eat the cost as a behavioral health organization for those, but for standalone recovery organizations, it's going to cost maybe them money to do this work, and they'll actually be upside down because of how hard it is to bill the raise, which we've heard from Sobriety House on certain topics. So this is something that I think is important for us in supporting recovery, our recovery community, and access to Medicaid billing, and to understand that the rates are dismal and a lot of these claims go denied, which takes a lot of extra work to get. So count me in supporting our recovery committee on this.
Yep, absolutely. I mean, I think you're right on there, and that I think leads well into the larger discussion about, behavioral health funding reform, right? As being part of the whole discussion of, how can we have a comprehensive behavioral health service or system if we don't actually support providers in providing the services that we are requiring of them? So, I think that fits nicely and into that larger conversation of and really access to, recovery services needs to be on that continuum that everyone is aware of, that every community has recovery-based services. So, I think this is a fantastic opportunity for BPAC to weigh heavily in on that whole process, on both the standard setting as well as the payment structure of what that looks like. So it shouldn't be just one code that essentially pennies on the dollar. So I'm with you, Bob. So the next one, secure transportation. We talked a lot about this. This is that setting up that non-ambulance, non-police transport when someone's in a behavioral health crisis. The health department, CDPHE, is promulgating or going through that rulemaking process. They're the entity that is responsible for setting up that foundational requirement for what these discreetly marked vehicles providing secure transportation look like, what the base standards needs to be, and then it's going to be licensed by commissioners of each county. So if you're interested in that, they meet once a month to talk about the rules about that. If you're interested in that, I can forward you the information, or forward you the information to get onto the contact list from CDPHE to be included. The next one is scheduled for Tuesday the 12th. They've had
Just have this vision, Ryan, of Men in Black showing up to take you in a secured SUV somewhere. It just seems, I don't know. I'm worried about secured transportation and what some counties might consider secured, therapeutic, by the way, transportation, and not Men in Black just coming to scoop you up and take you off somewhere.
Yep, and some counties already have it in place, right? So they have a provision set up, and honestly, that is very similar to what it is. It's, SUVs with a partition in the back. You don't have to go in handcuffs, and then there's a team that goes with you, so you're not in the back of an ambulance or handcuffed in a police car, as most law enforcement departments have a requirement that if you're in the back of a police car, you're handcuffed. As kind of a way to get around that. So there is a lot of, there's not a lot, but there are entities that do this kind of work that have been participating in the legislative process for secure transport. But we can't have this conversation about secure transport without talking about funding for secure transportation, and ambulance funding isn't there. So unless yeah, so I mean, it comes back to, I mean, how are services going to get reimbursed? Is someone going to get a massive secure transportation bill if they go in a secure transportation vehicle to where they need to go? So those are all pieces that need to get worked out on a funding side for this as well, not just the whole process of and what it looks like and the training.
Well, it happens with families. They receive the bill for ambulance transport. So there's the pickup, there's the service, and then there's the mileage per mile rate from pickup to drop off. And some bills families receive are in the thousands for secure transport of a loved one. So I think this is another great place for us to have a conversation on equity on who's paying for this, and that's straddling families with yet another bill. So yeah, this is another great intersection for us.
Yeah. So that's kind of a behind the scenes work on that, is that, I mean, there's talk about, do our mobile crisis teams, should they be secure transportation providers so they can actually provide the transport if that's what's needed, and they're the ones going out there or should be going out there, required to go out there per state law? Like, do we have our mobile crisis units actually be licensed secure transportation providers to actually provide this level of service that then the state has funding for, right? So those are all, I mean, pieces that are in discussion with this process, but it comes down to what is licensing, is licensing going to be very different across different counties, and what if you're crossing county lines? What does licensing look like? Do you have to be licensed in both counties? Does it count if you're, so there's a ton of work that still needs to be done with this. So yeah, but that's the health department is leading that charge, or required to lead that charge. The rapid mental health response to Colorado youth. So that was those 3 mental health sessions. Signal is the contractor for that. That should be up and running sooner now. At least kind of that platform to get screened and then have access to those services. So and maybe it's by, yeah, I'll double check what the timing of that is, but I know Signal is the contractor for that. They're working to get providers. Folks, that if you are credentialed by DORA, hopefully you did receive an email from DORA saying you can sign up for this. So that's what Signal is working on now, to get a robust system of providers to provide those 3 free sessions that the state will pick up. The 988 Suicide Prevention Lifeline. So that's that federally required. Every state shall have this new 988 number, very similar to like a 911 number, but have access to suicide prevention. There's a commission or an enterprise. So it's a state operated business outside of a state department. So there's a board that has to come with that. That board is set up. They have submitted or agreed upon their first charge. So in the next couple of months, or maybe now, starting in October, your cell phone bill or your prepaid wireless plan will have an additional fee on it. You can thank that, this bill for that additional, I think it was 19 cents or something, to fund this 988 Lifeline network that will go into effect July 1st of 22. So the funding, that's why the fee will be happening on cell phone charge on your cell phone bill now, to get it ramped up for launch in July. All of Crystal mentioned the Senate Bill 137 earlier. All of those programs are really kind of pushing along. There's a bunch of stuff within 137, a lot of different funding. Essentially all the funding is pretty much out the door in some way, shape, or form. That's the other piece, is that within the steering committee, talking about what representation or technical assistance from the Office of Behavioral Health should and could be. I said we should maybe have that conversation about ensuring that the data and evaluation staff are specific TAs to provide specific technical assistance to the Behavioral Health Planning Advisory Council, as well as a fiscal staff. So we have fiscal representation, so we can get those clear, okay, what does this mean? What is the process? Or maybe it's fiscal/contract staff. So we have better insight into what funding, as well as getting funding out the door at OBH. So it's a clear picture about how the behind the scenes sausage making of OBH and funding looks like. But we'll, I think, be talking about that moving forward with membership and just generally BPAC roles and responsibilities and moving forward. So with that, that's kind of all I had. And the OBH staff have any additional updates you want to add in here?
This is Bonnie. We have a couple of updates on the prevention team, including the move that may or may not happen. So just a quick question. I think probably anyone can say yes to this, but has anyone ever spent a lot of time doing those other duties as assigned in their role? So our good news is we're getting 2 new positions. I think one is starting next week. I have no idea who they are. And then we just posted another one. So one is actually, I think Margie's going to be happy to hear this, going to really focus on education and school-based services and prevention, making sure that we have a coordinated system across the state. And then the other one is really going to be focusing on collaboration. So if you remember from the slides that Ryan was showing us, a finding in actually many reports ever since I got to OBH was the fragmentation of the prevention system. So this person, it's going to be their job to collaborate between all the state agencies, between university partners, leverage resources. And this is something that, you know, on the prevention team, we've all been doing a little bit of, and in a very organic way, which in some ways is nice, but it means that we're missing a lot of things. So really excited for this news. If y'all know anyone in your networks that might be interested in applying for the collaboration position, it's on the state website. I can send it to you as well.
I don't have anything.
Ryan, I have a callback, if you could help us. I think the youth mental health evaluation program that you mentioned is actually a significant new enhanced service for Colorado's children and families. Could we have a presentation on that either? And we can talk about that in a steering committee, but I just wanted to add that as one of the callbacks. I just had a presentation on that new program, and it's platform based and it's virtually based, and it's actually really a robust new program for adolescents and youth to receive 3 sessions and a screening based on their mental health. And I think it's a really important program to get before BPAC.
Yep. Yeah, absolutely. I put that on our list that we can talk about in steering. And when we set the agenda, we can make sure that we get that on there.
I just had a training and a presentation on it, and it's really impressive. And I think council members will really like knowing that this is something healthy that has come out with use of our dollars. And I'm glad Colorado's kids can get access to this on their own, which is really important and I consider this a huge prevention piece to Colorado's system of care, this screening and brief intervention. So it's preventative and it's helpful, and it excites me. So definitely want a presentation on that. Is there anything else before I call the meeting? Any announcements? All right. I would just like a quick conversation. How do people like the one part of the agenda that's called What's Going On, where we can really get down to brass tacks into all the domains of Colorado and where people can speak in a very open and communicative way about what's going on in our communities. Is that something that worked today? Do people like that? And I obviously did not see how much time we needed to allow to that. It took about an hour today. And I only imagine this growing. So as I scroll through my phone, I'm seeing thumbs up, clapping. All right. So it looks like we will. Go
Bob,
ahead.
I'm wondering if you could maybe provide us with a little bit of structure of what would be expected if we do share or present something, so that we stay within a good time limit and that there's just a bit of structure around what we're sharing.
Yeah, absolutely. The steering committee can do that. We'll present on what that looks like
Thanks, that would be helpful.
at the next meeting. But it looks like we'll carry forth with those deep conversations in a structured way. So that way we all know brass tacks of what's going on. So again, what I can say as people get ready for the next meeting, the goal of what's going on in these domains is really, it's not really designed for announcements, but it's really designed to let us know what interventions are taking place, what programs are doing some really cool, innovative stuff. This is a way for you to really to update us. It also can be where the lived experience part of our council can let us know what they're hearing on the ground as to gaps and issues within the system of care. So that way we're having a dialogue and we can start building a better understanding on what is missing in our communities. So when we're making recommendations on a block grant, we're hearing live information. So I really consider this to be the really live, meaty part of our conversation. So I'm not expecting it to be clean, and I'm expecting it to be raw and real, and certainly need to know what's going on. So that way we all can work together in solving the problem. So, but it looked like everyone liked that part of the agenda, and we'll get some structure around it in the steering committee. But if there's no other announcements.
Hey, Bob, hold on. Laura, I know she's having problems with her microphone. She put a note in there about wondering if the council is interested at some point in hearing from the Office of Suicide Prevention at CDPHE and their efforts in the state.
Well, I would absolutely welcome that as a co-chair. I also want to know more about my dialing from my cell phone, suicide prevention, and how that will work. And I don't think we get enough preventative information in our council meetings. And I think prevention is key to keeping us from getting into the continuum of care. So I'd like us to also spend more time in what's going on in our community, hearing about family prevention, children prevention in general. So absolutely. And suicide has been, unfortunately, a growing statistic with the pandemic.
And looking at November, it looks like we have quite a bit. Do we want to push out to December or January, or do you want to try to get that in November as well?
I think that should be a December because of the holidays, and that would be a good topic because the holidays are tough. So we might need to learn about some resources that they can bring us so that we can share in our collective networks.
Great.
Let me know if you need a contact name or something like that from from OSP, Office of Suicide Prevention. I work with a couple people over there on the Zero Suicide Grant, so happy to help make a connection.
Any other announcements? Motion to adjourn.
Second.
Adios.
Take care, everyone.